carpal bones, the two rows, you need to know that there's a proximal row and a distal row. And so that, I mentioned this in class, and then you have your proximal row starting on the thumb side here, and then your distal row that's closer to your fingertips. Your proximal row starts with the scaphoid, okay, the scaphoid. And again, I mentioned too in class that the scaphoid is the most commonly fractured carpal bone. And it has in every one of our wrists, it has a poor blood supply at the proximal portion of it. So if you fracture that part of the scaphoid, that's a big flag up for us. So if I get a patient who has a diagnosis of a scaphoid fracture, I think, oh no, because it's always really a nightmare, because they're even though it's just a small bone, it's a very difficult bone to heal because of the blood supply, especially if the fracture's in that area. You can compromise it even more. The bone can actually go on to become necrotic, which could cause all kinds of issues with your wrist. Next to the scaphoid is the lunate. The lunate gets its name because it's lunar shaped, and it is the most commonly dislocated carpal bone. I mentioned that in lecture. And next to the lunate is a triquetrum. No big story about it except that the pisiform sits on top of it. And the pisiform you can only palpate on the volar side or palmar side of your wrist. And if you go right down your pinky finger, right to the wrist crease, you're right on your pisiform. And your pisiform is what helps to form one of the walls of Guillen's canal, where your ulnar nerve enters your hand. Now, in your distal carpal row, starting on the thumb side, we have the trapezium. Now, the trapezium is a very, very important bone because it helps to form the first CMC joint of your hand, and that's there of your thumb. And your thumb is the most important digit of your hand, but the CMC joint is the most important joint of your hand. It allows us to do a ton of different motions, such as palmar abduction, opposition. So we need that joint. Unfortunately, though, it's an area where a lot of people go on to develop arthritis. And the bone itself can become arthritic. The joint surfaces can become arthritic. So often we make thumb splints for people who develop CMC arthritis there. And or they have to go in and have the joint reconstructed. And we have to then follow them up for therapy after joint reconstruction. The other thing, too, about the first CMC joint is, again, it's formed by the trapezium and the first metacarpal. So I just want you to be aware of that's what really forms that first CMC joint. Carpal, metacarpal. Carpal is the trapezium. Metacarpal is your first metacarpal. Next to the trapezium is the trapezoid, the story. Next to that is the capitate, which is known as the keystone bone. It's the center of your wrist. And it's what we palpate when we measure ulnar and radial deviation. We take our finger, we slide it down the third metacarpal until we come right to the wrist creases there on the back of your wrist. You feel a little concave area. That's your capitate. Next to the capitate is the hamate. And the hamate has that hook on it, which can only be palpated on the volar side, and that forms the other wall of Guillen's canal. And so you have a ligament that goes from the pisiform to the hook of the hamate. But that nerve goes under and then enters into the hand. And it's an area of compression. It's an area of compression. Now, we've practiced palpating some of these. We talked about the anatomical snuff box is how we palpate the scaphoid, okay? If you put your finger into your anatomical snuff box, you're on the floor of your scaphoid. I just said about the capitate, which we already practiced doing. If you flex your wrist, the very peak is your lunate. So if you find your scaphoid and then you flex your wrist, that next peak is your lunate. Pisiform is at the base of the fifth metacarpal. It's on the wrist crease as you slide down the fifth ray. You come down and you palpate there. We also talked about palpating the hook of the hamate. So once I find the pisiform, I take my finger and I go about a finger and a half, maybe about 3/4 of an inch. And if I head in the direction of my index finger on a diagonal there, I can get in there, and if I palpate deep enough, now it's under a lot of tissue there, I can palpate deep enough, I can feel the hook of the hamate.